when they hear public health, immediately a lot of people think, oh, they don't pay well. I noticed that a lot of times people just don't know where to look, or the roles that will pay them in public health. We're not taught how to market ourselves. We kind of downplay all of those skills and things that we've done, and then we don't understand a lot of times how to translate them.
Welcome back to Talent Hunters, where we explore insights and trends shaping the global recruiting and staffing industry. Want to build talented teams that drive your company toward big goals and big growth? Then this podcast is for you. And now, let's join the conversation with today's episode of Talent Hunters, brought to you by HireQuest. Connect with us at hirequest.com.
Ladies and gentlemen, my name is Vince Holt, and I'm host of Talent Hunters. And today we have Dr. Desiree Strickland, the founder and CEO of the Public Health Club located in Atlanta, Georgia. Dr. Strickland is a visionary public health professional with over a decade of specializing in health equity, strategic planning, and career development. Welcome, Dr. Strickland.
Thank you for having me. I'm excited to be here.
Oh my gosh, I'm over the top. It's very special to have somebody with your depth and knowledge regarding our healthcare be a part of this. And so what I want to start this out with is, what inspired you to dedicate yourself to public health care, and what got you to where you are today?
That's a great question. So really what inspired me, from a young age, honestly, my goal was medical school. My goal was to be a medical doctor, a pediatrician specifically. But I got to college. I did undergrad at Florida State University, and the prereq classes, physics, organic chemistry, they call them weed out classes, and there's a reason for that. But to say I did, I ended up passing all of those classes, but I ended up saying, I wasn't sure I wanted to go to medical school. And I was talking to my mom, and I was like, Mom, it's such a huge financial investment to put in this, and I'm not sure I even want to be there. And then also, you got to take the MCAT and do all of these things. So I, through a program that I was in while I was in undergrad, I was able to get my medical assistant certification. So I was like, okay, well, let me work as a doctor for a little, work under a doctor for a little while and see, is this something I want to do? So I worked under a family practice physician, and I enjoyed talking with the patients. I enjoyed interacting. I enjoyed it, but I was like, I still don't know if I want to be a doctor. So I decided to get my master's in public health, mainly because I thought it would look good on a medical school application. That was the only reason. And I was like, okay, this is something I can do to bide the time and really decide. But I ended up falling in love with public health. I fell in love with seeing how I could make a difference on a population level with so many people at once versus just one person at a time as a physician. So I was like, wow, I really enjoy this. I really love it. And that was it for me. So my kind of first public health job after being a medical assistant, I worked for the State Department of Health in Florida, in Tallahassee, and I designed heart disease prevention programs throughout the state. So I was able to do programs that focus in on working with faith-based organizations and doing having them do blood pressure screenings. And I was able to have programs that focus in on working with pharmacists to increase adherence to medication for their populations that they were serving. So it was amazing to be able to have these programs, be a part in that, and just disperse them all throughout the state, and just it was amazing. I loved it. And I was like, okay, this is what I want to do.
I love that. I love that. And I can appreciate the looking at being a doctor and everything encompassed in all of that. As a child, as a teenager, I was going to be a vet. And I worked in a vet hospital. I did it all in high school, okay? Until one day, a man brought his little boy and a dog into the vet, and the dog was just mangled. And we couldn't help the dog. And the little boy, all he kept saying was, please save my dog, save my dog. And right then, I decided I could not be a vet because I couldn't deal with that pain of not being able to satisfy that little child. And so when you related to your doctor and looking at it and helping one patient at a time, in a way, I can kind of relate to that. But now today, you've started this business. What do you specialize specifically in today?
Yeah. So one of the gaps that I seen when I worked for CDC, I've worked for Florida Department of Health, Georgia Department of Public Health. One of the gaps that I seen was in workforce development. So essentially I was just like, we do such amazing work in public health. Number one, we're not talking about how to get further in our careers. Also, we're not talking about how to have side hustles like consulting, like different things that you can do to bring in income on the side, because a lot of people, when they hear public health, immediately a lot of people think, oh, they don't pay well. And I'm just like, being in it for as long as I have, and granted, I have not been in it for as long as a lot of my colleagues, but being in it for as long as I have, I noticed that a lot of times people just don't know where to look for the roles that will pay them to not only increase their income, but also continue making an impact that they want to make within the healthcare space. So I decided, you know what, I'm going to build something to help people get connected and plugged into different areas that they could utilize their skills. So like in the tech space, in the biopharmaceutical space, a lot of times when we're taught in school, the only things that we're taught as far as careers go is that the jobs are at the health departments or in the federal government. Those are the major areas where we are taught to look for public health jobs. And a lot of times they are oversaturated with applications. And then a lot of times too, within the Department of Health space, especially with local health departments, the pay is just not great. So a lot of people then get discouraged to even go into public health because of that. But, I've talked to so many people, and on our platform, the Public Health Club, I decided to create it. It's a membership community. And essentially we highlight every month non-traditional public health jobs. So one of the previous ones that we actually just did one the other day, focused in on UX research in the tech space. And a lot of people will see that and they'll say, oh, that's not public health. But one of the things that we do all the time in public health is we develop focus groups. We talk with people, we do key informant interviews, and essentially that is one of the major things that UX research does. They are looking at consumers, they are talking with them, doing focus groups, they are doing data analysis to look at what is working so they can make their products and services better. So we talk all about how we can translate our skills, but also like how to make this actionable. How do we translate our resume to show that? Because we can't just submit our public health resume to a recruiter for a tech position because they're going to look at it like, what is this? Throw it out. But how to translate your skills to really speak that language. And that is one of the major things that we do in the club, in addition to, helping people find consulting opportunities that they can do.
So you brought up recruiters. So you channel or help your clients find recruiters or help them understand how to be of better value to recruiters?
Understand how to be of better value to recruiters. Mm-hmm.
So what can recruiters do better to help your people?
I think number one, in public health, we're not taught how to market ourselves. So one of the things to know about the public health space, we do so many things and wear so many hats. So a lot of times I'll give myself as an example. So when I mentioned my first job that I had, I was a program manager. So that was my title. I managed the program. However, I also wrote the contracts. I also managed the contracts. I was a certified contract manager. I also did data analysis. I also evaluated the programs. I also led a team. I also did all of these things. But one thing, we as public health professionals, we kind of downplay all of those skills and things that we've done. And then we don't understand a lot of times how to translate them. So I think as a recruiter, kind of coming in and talking with someone that's in the public health space, really even just asking them those direct questions like, have you done this X, Y, and Z? Have you done X, Y, and Z when talking with them and stuff like that? Because I think a lot of times in their resume, they're not showing that they, did, because I also did grant writing. I was the one that secured the grants. So it was all of these things. And that is the norm in our industry, a lot of times for everyone to wear all of the hats. But what we don't understand is how to translate that on paper. So it's like, we're not putting in 20 bullet points under one position to show these things, but we teach them how to tailor their resume to make sure you're tailoring it to the actual role you're applying for. But I think that having a recruiter just kind of understand that about public health professionals and know that, we've done these things. It's just, we're not used to talking about and even just taking the glory for doing this work, because a lot of people that I talk with, they're like, yeah, I did it, but it was a team effort. But, we did this as a team, which is amazing. But it's like, okay, we need to talk about you, though. We need to see what you do.
Well done. Well said. The thing that I have found so much in my recruiting experience is most people talk about what they did, but they don't talk about what they accomplished. And people that are looking to hire people aren't as caught up in what you did. They're going to be impressed by profitability, change, whatever it is, what you accomplish. So you are absolutely dead on helping these people, because none of us have ever been taught how to market ourselves, because we're taught, don't talk about yourself, don't brag, don't, draw attention to yourself, be humble. And unfortunately, we take that too literal. Now, saying, well, I did this and I did that and I did this and I did that. Everybody can say that. But what they can't say, and you said it best, was let's focus on you. Yeah, you're part of a team. Public health is a huge team. What did you accomplish? Don't care how small it is, right? It can be huge, but even the small accomplishments are monumental. So stay true to what you're coaching your people with. Stay true. But let's get back to the recruiters, because I see where recruiters could be a real benefit to you. What do you feel recruiters aren't doing the right service for your people?
I would say, that's a great question. I will say, number one, the reach. I feel like the more I talk with people, the more we're not used to in public health to being approached by recruiters for positions. Now, I have been, and I think mainly because I built out my LinkedIn, talk on LinkedIn, they see what I'm doing, I'm visible. But so many people are not, they may have profiles, but they're not doing anything on there. So primarily I've been reached out to on LinkedIn by recruiters. But a lot of people that I know, that have amazing skills, they're undiscovered. They're not being reached out to with these opportunities. And even with, like some that I think too, a lot of times as well, they're not finding the opportunities that are getting posted. Because I noticed that, a lot of people that I talk to, they're going on LinkedIn, they're going on Indeed, but I do notice that I think we actually hosted a public health recruiter in the club a month ago, and she talked about just kind of like how she recruits and the things that she looks for, but she does not post positions. I don't think she posts her positions on LinkedIn, or I have not seen them there. And I noticed for so many other positions, people will now send me jobs to send to my community. And I'm like, this is great because now I can get in front of them. It's more visible. But I do think that they're not knowing even where to look for these jobs, or even sometimes the jobs aren't titled in the ways that we're used to seeing them. Because I think too, like with titling jobs, we're used to the things that we learn in school, the buckets of how we learn them in school. So like epidemiology is one area that they're going to search for. program management, maybe another area that they're going to search for often, maybe data analysis. But when it comes to, I know some people may think about all these different wordings for how they word and title these jobs. So I've seen jobs that say like insight analytics, and literally same thing as data analysis. But we're not searching, that's not coming up for them because they're titled in these different ways. So even though I can look at it and say, all of those skills, I can submit someone's public health resume right now and they will be a perfect match. But it's just not, so it's not visible to them because that's not the way we're taught. Does that make sense?
Yeah, it absolutely does. And I go back to the recruiter when I'm looking for an individual for a company, right? If I'm in your dig, the public health, are there locations that I can go to do the research and make the contact with these people?
Yeah, I mean, come to the Public Health Club. Come to the Public Health Club. I mean, we have so many professionals on all different levels, and that was, of course, the goal. So I have some that are entry level, but then we also, because we do like the focus in on entrepreneurship and consulting, and then doing it as a part-time side gig, we get so many people 20 years of experience. Like they're just looking for something new. They're looking to do something else, or they're looking for consulting opportunities, these more, part-time opportunities that they can do on the side. We have people that, they do have their full-blown own consulting business, but many are like they may be federal employees or ex-federal employees. They're looking for something new. Or they just may, they've been in their position for about 15 years. They may be looking to go somewhere else. Like we just had a conversation the other day about how they're actively looking for something new. And I'm like, they have all of this experience. But we would love if you have positions, to get them posted there, get them shared, talk them up, hype them up, and say, hey, if you have your skills, let's get you out there and seen. Because I do think too, sometimes with visibility of these positions, it can get lost in LinkedIn. And then also one of the things that was brought up by a few people on one of our sessions was these ghost jobs that they see, the jobs that people are they're scamming, they're not real jobs. I know some people have fell for where they'll post a job, there'll be a job posted on LinkedIn or wherever, and they're applying for it. They may get called or get an email, but then they need their credit card information or those definitely still out there. And then also they notice too that jobs will be posted for a certain company, posted and reposted for months. So it's just and they applied and they hear nothing back, or they may get an automatic rejection. But the job has been posted and they look like they're still actively recruiting, but it's been ongoing for 3-4 months. So it's I don't know if you are or not, are you just trying to get our data? And that was what one person said. So I think there's a lot of skepticism now too, from what I've seen and heard, in the job market.
So how can we, recruiter, you're the professional with your people, how can we combat that skepticism?
Yeah. I mean, I feel number one of the things I do also hear a lot of people saying is that they will submit for a job application and then they either hear nothing back, or they, they get that automatic, thank you, but no thanks. So I think having some kind of level of, and I know it's hard because the volume of applicants that people get. So that's always a thing I think about from a recruiter standpoint, the volume now, especially in the public health industry. But I do know that, if they're getting this rejection, or if they're never hearing back, that makes them skeptical about even applying for a job they may see with that company. So I don't know if it's if a way, and this is a whole, for going into the tech space and how they do the automatic rejections, if maybe the AI system can give them feedback on why you were automatically rejected. Thank you, but your resume didn't demonstrate X, Y, and Z. So we're moving on. And I don't know if that's even a thing that they thought about to do, but I think that would help so many people and just help them improve too in the process. But I think too, just kind of having, podcasts like this and getting it out there so people can listen to them and seeing like, okay, because we don't think like recruiters, right? That's not necessarily, if you've never done it before, you're not thinking like a recruiter. So getting stuff like this in front of them to say like, okay, this is what recruiters are actually thinking. This is how they're doing things. And I think too, like, going back to what I said earlier about things being like, you're getting for some jobs, thousands of applications. And even I just did a call for interns a few months ago, and this is a non-paid intern. I got over 500 applications, and I'm like, oh my God, this is ridiculous. So, but it's a testament to like, how the job market is. There's so many people applying for so many things. But just, I think, people coming from understanding that, and then also like trying to help them to understand too that, hey, this company is really hiring for this job. And I know these are one strategy that comes to mind. I'm always thinking of like random different innovative things we could do. But when a company has like a job posting, now we live in this age of social media. So why not have whoever is in HR, whoever the recruiter comes on and like does a TikTok or an Instagram about, hey, let's do a 30-second deep dive into this job and what we want, right? And then get that out there so they know, oh, this is a real person advertising for this job. Let's get it out there and let's see. And I think, one, you may be bombarded with applications, but two, I think it does help though, with getting things visible, getting it seen, and then also like telling them this is exactly what we want, even though it's in the job description, but giving that insider knowledge of knowing your client as a recruiter and having those conversations of knowing exactly what they want for this role.
So I'm going to go back to the beginning a little bit because I really want to understand this. Is your role to help the individuals that are looking for the job?
Yeah.
Okay. And do you work with potential clients as well, or are you just working with the candidates to help them better present themselves?
Yeah, so now I'm just working with the candidates. It's definitely a thought to work with the potential clients, but it's been a thought and it's definitely in the plans. But right now, it's just working with the candidates to help them to do their resume better. Like, how can you present? How can you even market yourself better? So we talk about things like creating a digital portfolio, creating like different assets that could help you get seen and stand out in a sea of 1,000 applications. So I think that that's one of the major things that we do inside the Public Health Club is helping the potential candidate better prepare themselves, present themselves, give them interview skills as well too.
Boy, that's phenomenal, because what you're doing is exactly what a recruiter does, but they're not doing in the vastness for what you're having to deal with.
Mm-hmm.
I mean, I'll get one-on-one with you and find out about you, whereas I'm an old dog, so my career started before technology. You picked up the telephone and you made calls, and sometimes they answered, sometimes you got screened out, whatever. Today, too many people look at technology and put on so much information about themselves without really hitting where they want to be. You're a perfect example of that. When you started, you wanted to be a doctor. And then, don't know if I want to be a doctor. But if you approached it from the standpoint, well, I'll do anything for anybody because I can spell this, you're not going to get callbacks from anybody.
Mm-hmm.
And so you are the perfect person, because of your experience, to be trying to help these people move forward. What I really want to do is I want recruiters to reach out to you. So in order to do that, how does a recruiter contact you?
Yeah, so they can just send me an email, info@publichealthclub.com. And we can get a call going. We can have a collab call and we can talk about what that could look like. Because like I said, we have so many talented people within this community. And, within my community too, like everyone builds out their profile so we can understand, like, what their specialty area is, what they're doing. And then we just have these spaces for people to, we have discussions about careers. We have our chat area. We have sessions, monthly sessions to talk about these different areas, like whether it's career development or consulting. So they're there, they're taking notes, they're coming, they're sharing their portfolios, they're sharing this, they're actively searching for these roles. So I think one of the things that is in our plans is to do like a somewhat of a matchmaking type service as well. So matching public health professionals with roles that are even outside of, like I said, one of the emphasis is non-traditional roles. So whether it's in the tech space, the biopharm space, just whatever space, just being that bridge to say, okay, I can communicate that how this role fits into this tech role, but my client, my customer may not be able to communicate that, but I can communicate that for them, and I can help them to be able to communicate that to you. So you can understand how they can line up. So that's one of the things that we're definitely working on transitioning into.
Dr. Strickland, I really appreciate your transparency, and I really appreciate you taking the time today. And unfortunately, I don't specialize in your industry, but I'm hoping the people that are watching this, there's people out there that get it, because today's job market across the board, not just public health, across the board is a challenge. And I can get my arms around exactly why. Some talk about money, there's just a challenge out there across the board. It's not political. I almost believe that technology is in the way, in a lot of cases, of the challenge, because people are looking for the easiest way, not labeling it easy, but they think they're going to get there and get callbacks because I can do this quickly and I can cover 100 different things a day.
Mm-hmm.
And we got to get back to the telephone.
I think that with technology, it's an information overload. And if you don't, I always tell my members, if you don't know what a good resume looks like, then ChatGPT, Claude, they will give you anything. And you're just going to go with it because you don't even know what it should look like. So you have to understand what it should look like. You have to niche down in those areas like you were talking about. And you have to have that prior information to be able to use AI technology responsibly and get the outcome that you want to have.
Dr. Strickland, thank you again for taking all the time today. I mean, I hope this generates some solutions for you.
Thank you so much for having me.